Hi, this is a recorded presentation to give you an overview of what the Employer Set project is about. So it's advice, it's guidance for you, a bit like a how-to. So in your first year, you have the 3 assessments. You have the Core A, Working in Health and Social Care, which is an exam. You have the Core B, which is your Science, Anatomy and Physiology, which is an exam, and then you have this Employer Set project, ESP. It's got an element of research, of report writing, role play, presentation, and reflection. The exams put together are 70% of the end of your first year grade, and the ESP then is 30%. Everything gets sent off to the exam board to be marked, and then at the end of the first year you get the 1 grade A to E. So it's not like a triple, it's a 1 grade A to E. Your assessments then in the ESP is done in May, and then the exams are in June with a resit opportunity in your second year in November. This is a visual overview of what the ESP looks like. You can stop and have a look and come back to this recording to see if there's something you don't quite understand. So there is a pre-task, a pre-task 1, and it's for you to demonstrate your research skills and your referencing. There's then a report writing task, so you are marked on literacy. So you need to make sure you can do that, and then you have to also demonstrate an understanding of numeracy, so statistical data about a particular health condition, for example. In 2A, you are recorded having a one-to-one interview with your case study person. Your case study person is somebody that you choose out of the 5 that you are given, and your teacher will be simulating the role of that case study person. So you will be interviewing them in the role of a healthcare worker. The whole project is that you are going to put together a healthcare plan for one individual. That individual is a case study that you will choose, and then your healthcare plan involves getting feedback from the case study person about what they feel about things, getting feedback from your classmates in a small group, and getting feedback from your teacher as well, who will be in the role of the supervisor of you as a healthcare worker. 2B then, you need to put this healthcare plan together using the level 3 literacy. For 3A, you're in a group, your teacher will put you in a group, and you will be giving feedback on the other people in the group on their healthcare plan, and they in turn will give you feedback on your healthcare plan. For 3B, you're putting together a presentation, and that will be presented to the supervisor. You will then be justifying why you have included various aspects in your healthcare plan. You're going to be demonstrating your digital skills. You will be using the notes, animation, transition, really show off what you can do. And in task 4, you are using reflective skills. You are evaluating all that you have done. It might be a good idea to know what the Gibbs reflective cycle is at this point and apply that. I'll go into more detail about each task, so don't worry if you got a little overwhelmed with that. The whole assessment will take 16.5 hours, but it will be done over a 2-week window. So one day you might be carrying out the pre-task 1, the research part of it in the morning, and then the task 1 in the afternoon. In 2A, you may be doing that 2.5 hours in a morning or an afternoon, whichever suits, and hopefully it will all go to plan, so don't worry about it. To give you an idea, the case studies, this is how much detail you get. Okay, the person will have a health condition and will be in a certain situation, a social care context. They will also have some of their personality coming through the case study, so their goals, their wishes, what they're scared of, aspects like that you will be analysing before you choose. On the website, you can access exemplar pieces of work. So you will have a student's piece of work that is grade A that you can be given or you can access yourself on the NCFE website. There is a grade C and a grade E if you want to have a look at comparisons. I'm going to refer to the grade A one as I go through the presentation. So your pre-task 1 is 2 hours. Like I say, your teacher might decide to do that first thing on a Monday morning. And then in the afternoon, you would be given the task 1, breaking it up. Please listen carefully. If your work looks like others, so another student or the group, the exam board assumes you have been given too much help by your teacher, such as a writing frame, or that you have been talking to other students. So they've chosen the same case study. You've then, when you're going out at lunchtime, break time in the evening, been chatting about what you're doing, and there's a good chance that that person's will look quite like yours. So it's important that you don't go talking about what you're doing, because the exam board won't like that, and you may end up with a problem. The task 1 is about understanding what you are supposed to be doing in your pre-task. Okay, this is the only task you have internet access for. And what you are doing is finding information on the internet, possibly using journals, and referencing where you've got that information from. You are to include numeracy. I will explain that in a minute. But it's all about researching. You have the internet and you are going to copy and paste different bits of information from the internet onto a Word document. The Word document can only be 4 pages long, font size 12, 1.5 line space. If you are really running out, you can actually use a 5th page with just the references on, but that might make it a bit more confusing. As I said, you have a presentation, which is 3B. Now, this is the only time you will have access to the internet. So if you wish to have an image on your presentation or a graph to show about statistical data, you will need to copy and paste it onto this or onto the 4 pages, and I suggest you super reduce it in size so that it doesn't take up much room. And then when you do your presentation, you will have access to this information and be able to copy, paste it and expand it so that your presentation also has images on and information to make it a bit more interesting. Just to give you an overview, I want to go back one, hold on, no, can't go back. Okay, so in a nutshell, this is what your task 1 is. What is the health condition of your case study person? What is the social care context of your health and your social care within that case study? So that is what you're doing, and you are then going to research almost like in advance of you putting together your healthcare plan. So the background. So you are going to say the case study will need, I don't know, a dietitian, but you need to have a background on why to be able to justify this. So anything you are suggesting in your healthcare plan, you need to be saying why. Let me explain what you need to do. Okay, so the background to a provision, so a service or the professionals that you are going to put forward to look after that case study person. You need to look at any legislation, any frameworks, any initiatives, any policies, any targets, which is a little bit more difficult to do. That will be the background which influences the healthcare that is provided. Within that, you must have some numeracy. So you will be gathering statistical data. To give you an example, in A9.1, you will have been taught about the NHS long-term plan. It's part of Core A, and your teacher will make sure you understand that. You should be given a bit of time to explore what that means. The NHS long-term plan has this vision of what should happen for a person that has a particular health condition: cardiovascular disease, diabetes, COPD. Okay, and you go and you find out about what that long-term plan is. What does that mean to that case study person? What does that mean to you who's putting together a healthcare plan? You need to explore that at some point so you're confident in using that. Then when you come across, for example, the cardiovascular, you can do a bit of copy and pasting that onto your task resort 4 pages, so you have that information, you know what the framework was, what they have in place. Another thing that you will learn about, or you should have learned about, in A9.4, so part of your Core A again, is the prevention agenda. So if your case study person perhaps has got the beginnings of cardiovascular disease, the prevention agenda will say, okay, what are we doing in this country that is addressing the issue that we have with cardiovascular disease? So that might be, what are we doing about tackling obesity? What are we doing about educating people? What are we doing about smoking? All of which contributes to cardiovascular disease. In your Core B, you will be learning about different health conditions such as COPD, muscular dystrophy, Crohn's disease. So you'll be learning about these, and you need to then also think about how can they be prevented. You'll be looking at the causes of these and how can we look at preventing that, because that will be the background of your healthcare plan. Say your person smokes and then has a cardiovascular disease problem. You're going to wow the exam board with your knowledge about the influences in the background that means you are putting this in place in the healthcare plan. Any inequalities, right? What inequalities means is unfairness. So your case study person, for example, may be homeless, or that they have suffered a loss, a bereavement. It may be that they are located in a particular place where they can't access services very easily. Okay, if you research, you can really find these out. In A2.9, you will look at evidence-based practice through reliable research. Your teacher will explain all that means, and you'll be applying those skills to your ESP. In time then, you will research the NHS website. You will perhaps look at the Nursing Times articles. You will be looking at the ONS data, which is where you'll get your statistics from. All sorts of websites that have all this information on. So you're looking at that healthcare background. So perhaps you're looking at the statistical data for how many people have Crohn's disease. You can screenshot the graph. You can then further research how much does this particular condition cost the NHS in terms of hours or money. See if you can find out that information. Can we prevent deaths? What is the mortality rate for this particular health condition? Or have they got a shorter life because they have this health condition? You will be expected to look at that case study person and investigate everything to do with that health condition, everything you can to do with the social care issue. And you'll be copying and pasting that information to put on your 4 pages so that you can refer to this as you come up with your healthcare plan. You will be taught about epidemiology. You should have perhaps been taught about it already. That is B125 in the spec, and it's B126. So you will learn terms such as incidence, prevalence, mortality, morbidity. You need to be using those sort of terms within your task 1 report, because you're going to be graded partly on your literacy, level 3 literacy. Let's think. You're going to be taught about integrated care, which is health teams working with social care teams to make sure a person's needs are met holistically. For a 2.10, you'll be looking at integrated care. For a 8.6, you'll be looking at the personalised agenda. So all this information you're learning in the core A, yes, you will be tested for it in an exam, but also it can be applied to your ESP. So your healthcare plan, you've got to justify everything that you are doing. You'll need that for your task 1. You'll need it when you are sitting with your peers. Oh yes, I decided to involve an advocate at this point. The reason being, I decided that there should be a neurologist. The neurologist will take an MRI scan of the brain. The reason that I've involved this person, so you're justifying it as you go along to show that understanding. Wow, the exam board. A couple of tips then. Multidisciplinary teams, again, you're looking at in a 2.10. You are bringing together a healthcare plan with lots of people involved. Okay, you're going to look at the person-centered approach. You're going to look at the physical needs, the intellectual needs, emotional needs, social needs, so the PIE's needs of that particular person in the situation that they are. Who should be involved with that person, and analyze the job roles. What are they bringing to the table to make sure that person, and that you've shown the exam board that you know who should be involved and why. You can Google search charities that should be involved. Okay, investigate charities. You will perhaps have in that case study some sort of informal carer, or a family member, a neighbour perhaps. In order to research what charities support a particular health condition, if you go onto Google, aboutmyhealth.org, so one word, aboutmyhealth.org, you can look at patient charities. There's one for Parkinson's disease. And if you go through their website, you can see what support they have. They've also got statistical data on there as well. You'll have a look at that. You'll copy and paste that and put it onto your 4 pages of research. Okay, another thing, you can go and Google search who should be involved in terms of professionals. So this may be where you find out about physiotherapy, dietitian, having a neurologist, whatever is involved. And you can go to Healthline, if you Google search that, who are the health professionals that should be involved in that. So your research is looking at, okay, what do I need to do for my task 1? So therefore, now I've got internet access, what information do I need to find so I can put together this report in my task 1? So, research. You need to research effectively. You're going to write a report. You're going to include numeracy, statistics, data, graphs maybe, and you will also be assessed on your level of literacy when you're writing this report. So you need to learn how to structure a report. And then of course there's referencing. Okay, that's the overall of the task 1. Let's look at it in a bit more detail. You're going to write a report, so you need to know how to structure. You'll start with an introduction into the task into the case study person. It doesn't have to be detailed, but that's the beginning of a report, so that needs to happen. You can use subtitles. I suggest you start with an introduction to the task and the case study person, and then you move on to what the health condition is. Okay, what is it? How does it affect that person? So this is the continuation of your report. What I've screenshot there is the grade A student, and the person they had was called John, and they had muscular dystrophy, which they will have learned about in the core B when they were learning about the musculoskeletal system, because the health condition there was muscular dystrophy, so that you will have an understanding of the health conditions. Treatment. You may want to write about the different treatments there are. If you have a little look at that particular bit of text, you have got the referencing throughout there. You have got statistical data. 70,000 people have muscular dystrophy or related conditions. Okay, they've got that from the NHS website. Moving on. Task 1 then, you will look at the impact. You are going to show the exam board in your report the impact, the actual reality of that person having that condition. So symptoms, okay, they're going to impact on that person's daily life. So looking at their point of view, what are their physical needs because of that situation? What are their social needs in that situation? What are their daily life challenges? Okay, are they able to cook? Are they able to get out of bed? Are they able to get to an appointment? So barriers faced. Is it because of their location that they will struggle to get to an appointment? Is there a psychological person? Are they reasons, sort of a barrier? Psychological barrier is somebody's scared, somebody has a mental illness condition. Sensory barrier, okay, are they able to hear? Are they able to see? Have they got a speech impediment or impairment? Have they got a financial barrier? Okay, are they obese? Because that affects whether somebody can get to appointments, how they feel about themselves in terms of self-esteem. And we're looking at things from that person's point of view. What is their current social care context? Is there a lack of education? Is it that they don't know something that they could be taught in order to perhaps look after their health, self-management? Areas of concerns then. So areas of concerns could be safeguarding. Okay, it's a basic need that needs to be met. For example, is that person taking the medication? That's a basic need. If they have this health condition, they have been given this medication. Area of concern is, are they taking it? Okay, so you will be writing about this in the report to really show the exam board you know what you now need to do to put together a healthcare plan. All this background has been noted first. So background then, why? What should you include in your healthcare plan? Personalised agenda. Okay, this must be included in your task 1 because you are demonstrating person-centred approach. You have learned about personalised agenda in A8.6. Okay, you will look at the any of the NHS long-term plan for different health conditions. So that's A9.1. I think I've already mentioned that. So that could be the long-term plan for somebody with diabetes, for example. What is the immediate plan? What is the longer-term plan? Are there any inequalities for that person that needs to be sorted in order for them to overcome the barriers? So you'll look at that in A2.3, or you should have looked at that in A2.3 to really understand this person faces this barrier. This makes it that their rights aren't being met in terms of equality. When other people can access something that they can't, this needs to be overcome. You have also looked at safeguarding. In A11.2, you looked at safeguarding vulnerable groups. All right. Again, we're looking at the background of why you need something in place. You will have already looked at the initiative Make Every Contact Count. And this may be a brief encounter, the contact for somebody that can say the same message as everybody else is saying. So the person that is obese may be because they are unaware of the Eat Well guide. It could be that they are in an emotional situation that means they're comfort eating. So the Make Every Contact Count could be simply the NHS non-emergency minibus driver that picks up people that have a bit of a transport issue to take them to a hospital appointment. And the same public health message will be in that brief conversation, could be, well, how are you doing sticking to your portions on the Eat Well guide, for example. You're looking at health promotion in core A, A9.6, but also in core B, B127. So thoroughly know what you're talking about in health promotion, particularly when it comes to lifestyle choices. Okay, how are these going to influence your healthcare plan? You can, in looking at the background, look at the mortality rate, the morbidity rate. You've learnt about these in B125, the prevalence, the cost. So diabetes, the person is taking insulin, which you will have learnt about in your core B. They're taking insulin. How much does insulin cost the NHS each year? How many of the type 2 diabetes do they think, in statistics, do they think could be prevented? Okay, what is there in place to help people improve their lifestyle that means they reduce the risk of them developing diabetes? We looked at Make Every Contact Count, that's the A9.6. Integrated care. Integrated care is where healthcare professionals work with social care services and informal carers to produce this person-centered approach that is seamless, and everybody is saying the same thing and we're all communicating. You've learnt about that in A9 of the core A, A9.8. Continuing then, oh, that's the same thing, is it? Personalized agenda. Yeah, just gone all through those. Okay, this is how your task 1 is marked. So you will find this information, mark band 4, in the grade A student exemplar. Okay, remember it was about muscular dystrophy, and I think the case study person was John. Okay, if you have a little old look down here, you can see the sort of things that the exam board are looking for in your task 1. I put an arrow there just to highlight relevant terminology consistently and throughout, so that you are using the correct terms that you have learnt in your core A and your core B, so that your level of literacy keeps high. Excellent application of written English. The very bottom one, evidence of excellent application of mathematical skills. So that's your statistics. Okay, you can come back and have a look at this. I know I'm whizzing through it, but you can start. There is an aspect of the exemplar called indicative content. Indicative content is what should be in your task 1. That's what they're looking for. Okay, if you have a little skim read of this, adopts a holistic approach. That's looking at the pies. Okay, and the environmental needs, so the social care context. Have a little scroll through yourself. They are looking for reference to the personalized agenda. Communication skills such as, is there a barrier to communicating? Is the person mentally unwell? Have they got a learning difficulty, which will mean communication needs adapting? It's got here also reference to sources, so NHS website, Public Health England. You've got the Care Quality Commission, which you will have learned about in your Core A. And you'll make it, and they're making LIMS. It says interprets data. So what does that actually mean? Now, that is what your pre-task 1 is about and your task 1. You should be able to get practicing how you can do this. If you're taught about Crohn's disease, which you are when you look at the digestive system, you'll then be able to have a little look at the background. Okay, how many people have Crohn's disease in England or in the UK? Is it life-shortening? What is the impact? What are the symptoms? How will that affect a person's life? Will they be able to be employed? Really investigate, like Sherlock Holmes with a magnifying glass, really pick apart what this means. Right, moving on to task 2A. Okay, you need to plan an interview with your case study person. So you've looked at all the background and you've looked at them theoretically by taking information off the case study plan, the case study, and you will have written your task 1. Okay, you need to plan this interview. Okay, after you have done the interview, you will bring together all your notes so that you in your head know what sort of a plan you should have in place. So this one is recorded and the teacher will also write a witness statement. So task 2A is 2 hours in total. And in order to put the person-centered healthcare plan together, you'll need to interview that person. You are still in the role of the healthcare worker. And in the plan, what do you want to extract? What information do you need? What do you want to test? So you might think, okay, they could do with an advocate. You know, I'm going to say what an advocate is and say, how do they feel about having an advocate? I could say that they needed to actually see a dietitian who will look at what they eat and how that can be improved. How do they feel about that? Do they know what that entails? Okay, the dietitian will look at what their cooking skills are like, what are their likes. They're not suddenly going to be expecting them to stop eating takeaways entirely and move on to eating salads. That's not how it works. So you'll have to explain the role. You may want to use props. For instance, if the person is an alcoholic and you want to talk about alcohol units that they need to reduce from 30 units a week down to 14 as a max, which is the government recommendation, you may want to, at the end of your interview, say, and here's some written information about alcohol units, and hand over them something that looks like a leaflet. The reason for this is sometimes in an interview, there's a lot of information, a lot going on. The person's a bit worried about it. And what they want afterwards is something to read themselves. So read about what an advocate is, for instance, what that actually means. And if they walk away and they have this information, they can read up and have a look at a later date. They can show it to a family member. They can refer to it. So sometimes if you think about it, you might want to hand over some sort of a prop. So think about that in your plan of what you're going to say. Now, remember, you are in the role of a healthcare worker. So you're not the doctor, the nurse, the social worker, or the advocate. Okay, you're the healthcare worker, and your job is to put together the healthcare plan. So you're not making promises to that case study person that you'll be there at the end of a phone call, or I'll come with you for the to speak to the advocate. You're the healthcare worker and you're putting things in place. Okay, roughly you can plan out what you need to do. So the whole of 2A is 2 hours, and it's about the patient simulation role play. 30 minutes, you will need to plan what you are trying to extract, the information that you want from that case study person. That could be, in the case study, it says that they are estranged from their sister, meaning that they don't have much contact from their sister. So in your interview, you could say, do you want to talk to me about it, just so I can get a better idea? Would you like to be back in contact with them? So you're sussing out what that person wants. Okay, now your actual interview, you should aim to talk and ask questions for 30 minutes. Okay, it's being recorded. It would be a good idea if you have sight of some sort of stopwatch, so that you know how long you have been talking for, because you don't want to go over the 30 minutes because it will just get cut off. After your interview, you then have time to consolidate all the information that you've gathered and the information from the task one as well. Get your head round, okay, what have I got to do to provide for this person? Okay, now I've put together a plan of how much time you could spend. This is really just an overview. It's an idea. Don't get hung up on the fact that, oh, I've got to do 3 to 5 minutes of building a rapport. It's just an idea to give you an idea for that half an hour how you can be breaking it up. If you want to practice your interview, and there's nothing actually stopping you doing that in between these tasks, you could actually ask a friend, ask your mum if you could interview them. What you can't do is interview somebody that is also doing the ESP, okay, because you don't want things looking similar at all. I've put there then that the importance of introducing yourself. So maybe you knock on the door, ask permission to enter. Introduce yourself, something that you can be practicing. Hello, my name is Sarah. I'm a healthcare worker and I have been asked to come and ask you a few questions before we put together a healthcare plan to make sure that you are supported. Okay, check the person's name. That's what you do, so you haven't got the wrong person, and it also means that you are aware of the confidentiality of talking to about somebody to the wrong person. You could say something like, we put do not disturb on the door, so there shouldn't be any interruptions. Because of confidentiality, and I want you to feel as comfortable as possible and just be yourself when I'm asking questions. You might want to say that I'm going to make notes as we go along because I'm a little bit forgetful, and I don't want to get anything wrong. So if you see me head down writing something, it's just for my own memory. Okay, it's from my point of view to make sure I get it all right. Perhaps to build a rapport to start off with, you could ask them about, basically ask them to introduce themselves, family, friends, the situation, how they feel about it. Building a rapport is building that comfortable bridge. You're both equal and there is no intimidation, there's no barriers. You could start with, oh, isn't it rainy? It's been rainy. Did you get wet on the way here? Again, that's common ground. You are both in that situation. You could be saying about anything like, how long did it take them to get there today? Have they been waiting long in the waiting room? To make them feel a bit more comfortable. The other things then that you're trying to extract could be their physical needs, emotional needs, social needs. Okay, I've written it all down there. You can have a look at this and read it if you stop the recording and read it yourself. But like I say, don't get hung up on this is what I've got to do. It's important towards the end that you're summarizing some of the things that you're thinking about. So it could be, so we are going to try and introduce you to an advocate. Okay, I'm thinking that we will look at perhaps a referral to the GP who will then be looking at perhaps getting you an appointment with a physiotherapist, for example. So all these need to be considered, but you are a unique student and you are doing your your own ESP. So it really is up to you how you do it. This is how you are marked, okay? Demonstrate an excellent understanding of the role in the team, the scope and relations of the care plan, okay? So have a look at these in your own time, because that's the sort of thing that you should have in the back of your head when you're carrying out this interview. On the grade A exemplar, this is the content that needs to be in there. Okay, you've got there adapts communication techniques with the chosen person. All right, so it may be an older person, it may be a person with some additional needs, it may be somebody that's really nervous, and you will adapt your communication to meet their needs. Okay, have a little look at that in your own time. Really think about that and get practicing. So your 2B, moving swiftly on, and just going back to reflect on this, the arrows at the bottom. So to do your 2B, you are putting together, you are finally bringing together all the information to put together a healthcare plan. So you will be given the research task information, you'll be given the feedback from your 2A and your consolidation notes, and you'll be able to refer to those when you are putting together your healthcare plan. There is a pro forma that has areas that you need to consider when you are putting together your 2B. So this is what the exam board says you need to include. So there's a row there for individuals' goals. So there may be goals in the written case study, or you may have got that information in the interview. Individuals' preferences. Again, this information you could have perhaps had a look in detail when you were interviewing them. Individual values, okay, are they really family orientated? Do they think it's really important to be employed? Okay, all aspects of how somebody thinks, what are they about, what is important to them. There is then an area to put any other information that you don't feel fits in. You then have these columns. Let's have a look at the first column. The first column then says healthcare support needs. So this is where you're looking at the PIE's needs, any barriers to overcome, such as communication or transport. What is their need? Then you've got healthcare support approach. Well, you're going to be doing this person-centered approach. You may want to say about Maslow's, meeting the basic needs, daily living activities support. They need support perhaps in changing a lifestyle factor. So you've considered make every contact count, so that everybody is saying the same thing, such as quitting smoking, and being supportive about that. Not a lecture, just information to make sure that person feels supported. Professionals involved and justification. So this can be brief-ish, because in your presentation and in your interview by peers, you can be verbally saying justification. So why do you think the advocate should be involved? Why do you think that a social worker should be introduced to the person? Okay. So that needs to be in that column there. Looking at current immediate recommendations and future goals. So immediate one could be, there's a safeguarding issue. What are you going to do about it? The person is homeless. The person is living in an environment where there is domestic violence. So what do you need to do to make sure that person is looked after? For 2B, again, no internet access. It's supervised. You won't be talking to anybody. You're looking at previous tasks and coming up with your healthcare plan and explaining why that is. 2B, have a look at the mark scheme on page 33 of the grade A exemplar. see what it needs, okay, justifying it, working a time frame. A time frame could be you're going to reduce the amount of alcohol units from 30 down to make sure they're below 14, which is the government recommendations, over a length of time. You're not expecting them to go from 30 to 14 overnight. You're aware that this changes in lifestyle choices actually takes a little bit of time to work on. Safeguarding concerns then, A11, it may be that you need to comment on that. Indicative content, okay, so for your 2B, you need to have a look at the indicative content. What should be in there? Okay, because this is from the grade A, there is reference to people like Tanya, as if, okay, Shalin, you will have your own healthcare plan that you put together, which won't include those people because this is for a specific ESP. Moving on to 3A. 3A, your teacher will put you into a group of 3 or 4 people. You will be expected to sit around a table, which it will be videoed, so make sure where you're sitting you can actually see the clock timer. So you might be on a table facing somebody, but over their shoulder it might be a good idea to have some sort of visible clock so you can work out how much time you are taking. Prior to your 3A sitting down together, you should be given printed off the healthcare plans of the other people in the group and your own. So in your hand you should have 4, if there's 4 people in the group, healthcare plans. You will also be given a form, the peer discussion feedback form, which you will be handwriting on. Remember, you're assessed on literacy level. You will read other people's plans, okay, so you're reviewing their care plans, you're using critical thinking and communication skills to give them feedback, okay, there's a style, there's a way of doing that. Obviously you don't launch in for everything that you think isn't very good about it. So you're reading other people's and giving them feedback. Refresh your memory of your own plan. Now, you could have put together your 2B on Friday, but then you're not doing 3A till Tuesday the following week. So you'll need to have a look at your own healthcare plan because the other people in the group are going to ask you questions about it. And you need to be prepared for that. Quiet students need to consider making sure their voice is heard. Students that overtake a bit need to be aware not to do that. Start with the positives, what's going well. You might want to ask a question for getting them to expand on a particular point, to explain a particular aspect of their healthcare plan. On your form, it will say questions asked by peers, what peers felt went well, example of how peers thought you could improve your plan. And you'll be writing one of those out and they'll be writing one for you. The whole task takes 3 hours and 30 minutes. Okay, 1 hour to read your peers' healthcare plans and make notes about questions you might want to ask. 30 minutes to go back over yours because you're preparing for your peers to ask you questions in a discussion. Okay, 1 hour, 30 minutes in total. So 30 minutes per person for asking those questions. So you're going around each person saying, well, why do you think that should be in place? Have you thought about this? Okay, but again, you're not trying to do their work for them. You are doing some sort of critical analysis of their healthcare plan, and this is recorded. You've got 30 minutes to complete your handwritten notes that reflect on the feedback you have been given, and your teacher is also going to write a witness statement. So that is you sitting with your peers in the role of healthcare workers that have put together a healthcare plan, and they're asking you for your feedback. 3B, still no internet access. You need to access your own stats and images from your pre-task 1 pages. You are going to be looking at your healthcare plan. You're going to look at the feedback forms you have done already. And you're going to be looking at justifying why this is now your plan. You have amended it because of this feedback that you've been given. Okay, you're going to present your healthcare plan to your teacher or teachers that may then have some questions afterwards. So you will be standing up in front of a presentation. You will use presentation notes because you have to demonstrate good digital skills, and you will be referring to those. Nobody's expecting you to do it off by heart. You'll be referring to those then during your presentation, and this will also go off to the exam board so that they can see how you have planned it, what you had planned saying. So you don't want lots of information on each slide. You want perhaps an image on there, some bullet points, and then you're going to verbalize, perhaps justify why you thought the dietitian should be involved, for example. Your teacher is in the role of the supervisor, can ask a few questions. Now, it could be that they prompt you to expand on something you've already said, or have some sort of question that needs you to explain or perhaps justify clearer because they didn't understand something. Make sure you know and practice how to put together a presentation, your digital skills. You have got 2 hours to prepare your presentation. Your presentation should be aiming at 15 minutes. Make sure you have some sort of some clock that you can have a look at to make sure you're on task. And then at the end, there are questions from your teacher. It's all recorded, and that will go off as evidence again to the exam board. Have a look on the exemplar about what you will be marked at for mark band 4. Articulate, okay, justifies the selected strategies, the techniques, the background of why something is in place. Highly developed ability to reflect and apply to feedback. So when you're asked a question, okay, you might go, can you just clarify what you mean? It's okay to do that as long as you're understanding and communicating in an appropriate way. This is what you'll be marked by, page 39 in the grade A exemplar. This is the indicative content. This is what needs to be in there. Okay, summarize key points from your research. Okay, I found out that there are 120,000 people with this health condition. I found out that the cost of professionals involved with them and the cost of prescriptions means this. I also discovered that with a change in lifestyle choices, that it will reduce the risks of further complications. Okay, task 4, almost at the end. Then there is a pro forma for you to complete for this. You must consider how you felt about your approach to the overall project, how you achieved the tasks, okay, how you responded to questions from the supervisor, okay. I've gone by that. You need to consider then how well you did for each task, okay. Think about it. Task 1, how well did you do for that? Task 2, what would you do differently? So you're evaluating how you did, and you're kind of extracting from that your learning, okay. And if you did it again, what would you do differently? Really show the exam board you are analysing all that you've done. You have grown by doing the ESP, and you have become more knowledgeable and competent in understanding about healthcare plans. This is how you'll be marked. Not much information. Interestingly, the chief examiner's report said this was the weaker area for students. So it says here, for this task, there was significant lack of formal written English displayed and an understanding of reflective writing. There was often little justification for judgments on students' own performance and a lack of appropriate evaluation. So read that. You could have a look at the chief examiner's report to see, okay, where are the weaker areas? What do I make sure that I focus on that and achieve it? Indicative content there, page 41. Have a look through that. What does it need to have in there? All right, back to the overview. This is your ESP. Your teacher will give you a time that you are doing task 1, a time you are doing your task 2A. They're not going to be on the same day because 16.5 hours is done over a 2-week period. Practice becoming more confident when doing a presentation. Practice interviewing people, your introduction to yourself. You can do all this so that you are more prepared. There is a reflective journal that you can be using to reflect on how well you've done in an exam or test, how well you did at a presentation, how well you did at some research. Within there, if you go on the QR, it will take you to a website that means you can download your reflective journal. And there's information on how to use the Gibbs reflective cycle, which you will need in your task 4. In addition, you have their free booklets. So there's a booklet on the core A, and it's got all the content, and it's red, amber, green. So if you don't understand something, that's your red, and you mark that in the booklet. If you are not too keen or sure about it, that's the amber, and then there's a green. Got it, know what I'm talking about. And if you go through that, you can go back and see A9.2 and make sure that you know about that. Go back and look at B1.25 and make sure you know the terminologies in epidemiology. Okay, right, that's it. I've taken way too much of your time, almost an hour. Really, really best of luck to carry out and achieve well first time round so you don't need a reset in your ESP. Go for it.